Good morning. Um, as I listened last night, and as I listened to Dr. Brown and Dr. Juarez this morning, and as I chatted with other people, I said, what is it that I'm going to say to you that you don't know? But I'm going to tell you some things you don't know that I don't think you know, or an approach I think you need to take in what I have seen emerge in these last 6 years. I may not have been part of your communities of practice, but trust me, I was on the periphery. I read what you did. I was in your virtual one last year. I listened in, it was great. And so I want to talk to you. And the first thing, if you'll put up the first slide, if the first thing I want to talk to you about, second slide, is what I conceptualize that you've done. See, I use this because when my dissertation was on change and an interprofessional practice, education and practice. So I like the way the Colebrook Center uses evidence and implementation and has brought out this schematic. I thought that what I saw as I read all the stuff that both doctors Juarez, that you felt and you knew that there was a need, there was a problem that needed to be fixed. That's part of what happened with the change. As Dr. Juarez, Dr. Paul Juarez just said, you sat down and you figured it out. What were the specific needs that you felt as a community of practice you needed to address? You got to the resources, you got the stuff, you got the input from folks all over this country who were the experts in this field of community practice. And then you had the activities, what was done to address the need and lead to the change, because let no one fool you. What you are talking about in communities of practice is changing mindset, changing thinking, changing medical education and education of not just health professionals, but a whole cadre of people so that social justice and equity will occur for the communities that you have so well described. Now you're at the part where you're looking for how you're going to get the practitioners to begin to, and the systems that will arise from the activities that you have addressed. I think this is where you are between implementation and total outcomes, because you're still in year 6. You haven't quite yet really done all the pieces that go in. I mean, you're there, but you're putting it together. So and then I have another slide where I think I'll go back. And so here, the next slide. So this is where you've come with your years 1 through 6. This is what you've developed so far. Just so I remind you, I know you know it, it's all in front of us. But the groups that you concentrated on, again, let no one fool you. They are the most marginalized groups of people in this country, and don't have any of these in combination, don't have any of these qualities or characteristics intersect, then not forget it. You are really, really at the bottom of the populations that don't receive care, never see anyone. And then I counted 7 modules. I must tell you, it was, I don't sleep a lot, but I read through your models. And just looking at your providing mental health services for people experiencing homelessness, I told, for those of you who put it together, brilliant. Providing care for vulnerable populations, LGBT persons experiencing homelessness, migrant workers who are experiencing adverse childhood experiences, providing the telehealth services for the migrant farm workers and persons, again, experiencing homelessness, teledentistry, which I think in and of itself is a fascinating thing. I did a presentation for the American Dental Association just before the pandemic. And it's nobody ever talked about anything about people who are so poor and have issues with dental work or dental care. Some of the most not provided for groups of people. And then your vulnerable populations, the training health professionals to provide care, which I think is the crux of some of what I'm going to talk to you about today, which is about how you're going to sustain, how you're going to continue to build this curricula. And then opioid use and disorders. And I know we have someone who will be talking about that today. And then persons experiencing homelessness and sexual violence. Next. So as I said, I think this is where I have the check marks, where I think you've gotten to here with some, and this is where I think we are, or you are. You can tell me if I'm wrong as we have a roundtable discussion. But I need thinking, feeling, because we're now looking for responses from people outside of the communities of practice. Because you can't hold it all for yourself. You know, there's some of us who know there are lots of people who need some of this. And then this is the part that's the most critical. How are we going to change the behavior, practice, the relationship, the state that currently exists? How are we going to get this done? Next slide. So, what is the desired state? Let me just go back and say to you, when you talk about building sustainable communities, sustainable curricula, I like to use the work done by Rowena Scott from UK, who talks a lot in her e-culture article that I've used in the past on how you get to build a sustainable curriculum. A sustainable curriculum is transformative. It's got to be transformative. It has to be one that changes behavior and changes people. But it has to be innovative. The same old don't work. If it did, we won't be sitting here today talking. So we got to talk about innovation. And then in a sustainable curriculum, you're going to be sure that in the presentation of that information and data, it raises questions of those who are participating. It involves critical thinking and critical decision making. These, I see in reading through your curricula, are the aspects of what you have devised thus far in your communities of practice. So how will you continue to build sustainability for this curriculum? What is the desired state you wish to achieve? I say we, and then I scratched down once and said you wish to achieve. So let me give you some of my thoughts of how and what I think. And, you know, some people who hear me speak think sometimes that I'm not causing a revolution. It already occurred. Some of us missed it, but it happened. You've done an outstanding job. The implementable case studies that you have done, Dr. Ramesh and Dr. Brown and others who have spearheaded that, must be heralded for their currency and evidence-based approaches, which is critical in sustaining curricula. And the approaches are for all the persons we described, people experiencing homelessness, migrant workers, LGBTQ. The policy briefs are well done. And it gives us a compass for influencing stakeholders, not just all stakeholders, not just the medical community. But what I want to talk to you about briefly is some other things you need to think about. You got to continue if you want to sustain curricula, in making sure there's always a curriculum that has problem solving. That's part of its basis, and experiential learning. And that's what a number of your case studies do. But in what you've done, you got to get some spread. You've got to now look at how do you spread this? Who else needs to see this? I know you got 2.some million hits on your website, but I shouldn't say this, but so what? What happened? What happened with it? Who did you reach? What did they say? What are they doing with what you got? So I want you to do, and I know people don't like this because I was just talking about, regulators. Regulators are important whether we like them or not. The other folks who are influential are the people who we call accreditors. All right? Folks, you got to influence the people who are your accreditors. Anybody in here on the accrediting board for the medical school curricula? Hello? That's how you're going to continue to build your curricula. You have got to go and influence these folks. Find somebody who thinks like you and get them to run. Get them to go respond to everything. They have to see it because they have to see it. It has to be there. But for those who are the measurement and evaluation folks, you got to have it defined and somebody got to measure it. You can't say, we have to do this. We think this is wonderful for our medical education in primary care. But it's not going to happen. It's not going to happen unless it is worthwhile for the accreditors to see and measure what you're doing. It's a good, it's a feeling good. It's thinking, it's understanding, but somebody's got to accept this as what needs to be. So I must say to you today, you got to become good disruptors. I believe in disruption. I think it's a strategy that needs to be done by all of us who are in, folks see academicians are being elite and they don't get themselves involved in these kinds of things. But for this kind of work, you got to disrupt the system. You have got to get and engage the accreditors. You've got to get in there and you've got to present. And I don't know, I know you use social media, your website, but one of the things that you really, really must do is you've got to, and I know I was telling Dr. Holder last week, your blog, are you guys blogging? Hello? You're blogging this? You're blogging this information out. It's out. You're having people respond to you. You're doing podcasts. Yes, that's part of it. But who is it reaching? Who is it going to? One of the key things about sustainability in a curriculum is that you have to move from engagements of the individuals to engagement of community. And I see that you do this. You have to help the students who you are working with to know that, yes, they've learned. Now the shift has to go to community. If the community does not buy in, then you can forget it. For instance, I know you've heard of the National Clinician Scholars program. I happen to be on their advisory, but one of the key things that some of the programs do is each piece that they do a part of the community. They have a whole community group where they are actively involved in what's happening and changing what's going on in communities. This is an approach that you can use in your curricula to make it a part of what your medical students must do. And I see Miss Cotton, this is what has to be. Your medical students must. And primary care, you're the frontliners for I know they're looking at time. They're the frontliners for patients. But guess what? You have got to make sure your students understand. And is Dr. Collins here in the family medicine? I know they're out there. They're meeting with community groups, aren't they? They're going out and visiting people's homes, walking around neighborhoods, seeing what's going on, engaging in churches, right? Because your program in getting this message out and keeping this curricula sustainable ain't gonna work unless that happens. Because if they're not on your side, they're gonna be against you. Not purposefully, not intentionally, but it will happen. The other piece is your policymakers. I love your briefs, but somebody got to read them besides us. Somebody besides us must read them. Pick out a person who is out there who's willing to work. You got, well, I don't know how many doctors you got in Congress. We got 3 nurses. Go after, well, one, she doesn't say she's a nurse. That's Marsha Blackburn from here, and she's a registered nurse. She's a registered nurse. But the bottom line is, hey, one of the things in building curricula, you got to bring some of the dissidents over to your side. That's part of disruption. You got to challenge them. You got to challenge them. And she may not go for all, but she may go for some of the pieces. And we have some other folks, Lauren Underwood and Corey Bush from Missouri. They're nurses. We'll give them the piece. But let me leave you with the last thing. I just got my signal to shut up. But let me leave you with a piece about continuing to have sustainable communities. As we do in acute care hospitals, we use Press-Ganey scores. It's about time we begin to use those kinds of scores with communities. And with, students evaluate faculty. We got to get them to begin to do a deep dive in evaluating these kinds of briefs and this curriculum. And if you get a like Press-Ganey score for folks from community and your students and other organizations, I think that you won't have to worry about sustaining your curricula. Awesome, detailed, wonderful. I'm so glad that I had a chance to read them. I am going to use them in everything I can. I will make sure our department goes and downloads all those curricula and begin to use it with our students because it cuts across all health professionals. Thanks for inviting me.